All right, we just finished up on this case here. So it's a spondylosis 4556667 with a right-sided radiculopathy. These are our post-op pictures. So everything's in position. I was listening to a spine surgeon the other day talking about surgeries and the old surgeries and how horrible they were. And that was the technology we had at the time. Skin to skin, we were under an hour in this operation. From the time we made the incision, we're just a hair under an hour. Now, to do this surgery in 1990, this would have been maybe a 4 or 5, 6 hour operation. You have to harvest a bone graft from the iliac crest, close that incision up, and then fashion the little cages that you made, the little struts, and take the disc out. And many times in our institution, cervical traction before we had a distraction device. They'd actually put skull traction on, with a halter, and the anesthesiologist would pull on the halter. So for the most part, these operations worked very, very well. Patients were in very, very big restrictive braces, 4-poster metal braces. Sometimes the brace hit one of our department chairman of our orthopedic department went to Cleveland, and Henry Bowman did a 3-level fusion on him, and he had a 4-poster brace, and it ulcerated the back of his skull. So, the operations worked, but that was the technology we had at the time. And if the operations didn't work, we wouldn't be doing those operations. Just that technology has evolved, just as civilization has evolved. We're able to take technologies used in other areas of civilization, space exploration, computer software, racing cars, all that stuff, and apply it in the operating room. And that makes our operations much less complicated for the surgeon. Even though the technology is very complicated, it makes the operation shorter and safer and more effective. So, I was there in those old days, and it's great to throw shade, but, truth of the matter is those operations did more benefit than harm.